Welcome and good evening to all of you. For today, we are inviting you to participate. Today's session is very special, rather to say, and important. And sometimes you found it's not easy as well. So we are trying our best for you so that you can understand the topic according to your need. So this is the biostatistics with my usual humble introduction from the institute as well. With the moral alert, we are going to come to the topics of today is the biostatistics. Many often you have heard the word sensitivity, specificity, positive predictive value, negative predictive value. In our learning time, sometimes we ignore the topics because we don't understand the topic. So today maybe some learned participants are here, those who are more conversant about the topics, no doubt. But our attention today is to let you know how we utilize our minimum knowledge of biostatistics in our clinical learning. Side by side, it will fulfill your requirement of part 1 examination in the clinical examinations throughout the world. So part 1 is relevant in the MRCGP as well as in MRCP, even any other clinical exam throughout the world. So today we will try to give you some basic ideas of the biostatistics as a primary knowledge. Not the whole details, definitely. It will be a very big one and will take too much time, many days. But our idea first to give you very basic, primary, understandable things to let you know easily. And side by side to discuss some few diseases where we utilize it very well. Hopefully, it will be again very interesting and useful for you. So my humble request that be connected and be interactive as well as before until the end of the session. So in the biostatistics, we have to remember this gentleman, Carl Friedrich Gauss. He is the inventor of Gaussian curve, normal distribution curve. Though we will not discuss the normal distribution curve today, but he was having very tragic history also, and that is mentioned here. If you have the time, you will read it by yourself later on. How he was devoted in the topic. And in my very minimum personal learning in biostatistics, what I like to say in different occasions and different sessions also, the biostatistics is the poem of the science. You understand the word poem, written by a poet. So in that sense, this gentleman, in my sense, is a great poet in the history. So anyway, we will not be busy too much time in the introduction. You just look at that when we go through SLE, especially the investigations, you can see we are reading in this way that the anti-nuclear antibody positive, it is 99% patients, and it has high sensitivity, and it is useful to rule out the test, but low sensitivity. Again, if you come down, anti-double strand DNA, highly specific, more than 99%, but less sensitive. Anti-Smith antibody, highly specific, more than 99%, and sensitivity low, again only 30%. My beloved colleagues, please anyone tell me now, what do you understand with this message? Please, anyone, whatever you are wrong or you are unable to understand, no worry. I believe all of you have gone through the message or informations in your learning book or text. Please, anyone who can say about this message, what did you understand when you were
So
learning it?
this anti-nuclear antibodies can be positive in any other disease as well. So we have to see the sensitivity as well as the specificity as far as SLE is concerned. So we can judge from there the positivity of the disease. This
You
is
are
how
you are
can,
you are almost right, almost right. But for the SLE, if I apply the test, that chance of test being positive, it is the 99%.
yes,
This is the idea. Suppose in a positive patient, 100 positive patient of the SLE, here, if we test these with ANA, chance that 99% will be positive and 1% will not be positive.
yes,
It is true. But these 99% positive also, there is a chance that there are other differential diagnoses of the SLE like presentation, for example. In those cases also, ANA will be positive.
yes,
So what does it mean? It means that though ANA is positive, actually it does not diagnose the case.
very true.
This is the message for you. If it does not diagnose the case, we have to select another test, that is anti-double strand DNA.
Yes.
What is the
So we
message
have
of
to see
this?
the,
Yes, what is the message of this? We have to learn another word. It is called the specificity.
yes,
So a specificity, the main understanding of a specificity is, if we do the test, the disease is not SLE, it will tell actually this 99% that this disease is not SLE by definition. But in the technical message, we like to say the highly specific test actually utilized for including the disease.
yes,
Just I like to say in a very short word, the specificity role in the disease. Role in the disease. The biostatistics lessons and others better to be understood by reading, not by listening.
yes, sir, clear.
You just listen my words and try to absorb something and go through your learning materials. But
Yes,
we will now come to show you the list of ANA positivity in different diseases. So now you can understand, suppose you are suspecting clinically SLE, as well as it may be other diagnoses also. For example, systemic sclerosis. You know, the photosensitive rash in the face, for example, the skin rash simply can
yes,
happen in SLE, can happen in systemic sclerosis also, even other connective tissue disease. Somehow, as a doctor, we are thinking that this is connective tissue disease and differential so and so. We are applying our knowledge for diagnosing the disease by anti-nuclear antibody. So you can see that the anti-nuclear antibody, most likely in the SLE, it will be positive. But again, it will be positive also around 80% in the systemic sclerosis. So you cannot differentiate that by A and A positivity. This is SLE or this is systemic sclerosis. For example, we will go for other investigation which will be specific. So ANA is actually a sensitive test. Okay.
so anti-DNS, DS.
Now come to the list there. Separately, not ANA. Okay, not ANA. There are different
Yes,
characteristics of the ANA. And in the ANA, there are different molecules are there. in the different molecules, there are some other antibodies. It will help in the diagnosis of other diseases. For example, if we say that it could be systemic sclerosis, what could be the test? Dr. Namaz, can you identify from here? You
Yes,
see,
system.
scleroderma. This is
Yes.
scleroderma, for example, the same thing, SCL70. So if I do after the ANA positivity, the next step of investigation is according to our clinical suspicion. If I think more likely our probability is the SLE, then I will
Yes, DNA.
do anti-dsDNA. But
Yes.
clinically, if I think it is scleroderma, I will advise for SCL70.
Yes, very clear.
Again,
Yes.
again, I am confused. This is SLE or systemic sclerosis. Then I will advise anti-dsDNA as well as SCL70 antibody as well.
So it will be very clear.
Clear now?
Yes,
So
yes,
this
yes.
is the clinician's understanding when I will advise which test. Okay. So investigation always actually directed by the knowledge of history and examination.
Yes, sir. This chart is very important.
Anyway, so there are different, it is not actually we discuss maybe in our rheumatology classes. So you can go through also about those tests. Actually, I opened the issue just to make you understand the importance of the biostatistics knowledge. Anyway, so in the exam, especially like AKT exam, the Royal College actually expect that the candidate should know minimum this thing. I'm telling this is minimum. You have to know a
Okay.
little more than that, and you have to extend your knowledge of biostatistics further as well. So we will guide you further, but our topics will be with this, as well as actually we will be talking on other terminology. Unfortunately, I didn't mention this is called uh, likelihood ratio. Is actually part of the performance of sensitivity, the screening test, as well as some risk stratification in the subsequent topic. So in the initial part, we are discussing with this now. Okay, so from there, if we try to understand the specificity, sensitivity, we like to understand the word screening. Simply screening, you have heard the word screening test. For
Yes, sir.
example, if I say
Yes, sir.
about the SLE again, the ANA, one kind of screening test.
Yes.
Screening means it will exclude the disease. That means if the test is negative, I will say this person does not have the disease. Suppose by the blood sugar test, blood sugar negative, I will tell that this patient does not have diabetes. Likely for the SLE, screening test will be ANA. In the ANA, as being a screening test, we should say that the ANA will have high sensitivity, but it will not be with high specificity. Everywhere, whenever we select a test for screening the disease, we need to select a highly sensitive test. Okay,
Very true.
fine. And come to now, common screening test we utilize in our day-to-day practice. You can see now here. So if you discuss anyone from there, for example, PSA for prostate cancer, what meaning we actually attain? If PSA is positive, do we tell the patient having prostate cancer? What do you think?
Sir, this is most specific. Yes, we can.
No, no, sorry to say.
Hmm.
PSA is not specific. PSA is sensitive, sensitive in a sense. If we say, if we get the result PSA negative, we are telling that this patient less likely to have prostate cancer.
Okay.
But PSA positive can be positive not only for the prostate cancer, even in the UTI, PSA may be positive. The patient taking the dutasteride or the hormonal therapy for the prostate, the PSA will be positive. Okay. As
Okay.
PSA will be positive in many diseases, the value of testing PSA is to exclude the disease. Exclude means rule out the disease. That if the PSA is negative, we can say there is no chance of prostate cancer or very less chance of prostate cancer. Okay. Again, if you can be confused with the fasting blood sugar for the diabetes, the very word is fasting blood sugar. Fasting blood sugar, okay, it can detect a patient having hyperglycemia, but doesn't mean that fasting blood sugar will tell that patient have diabetes in every cases.
No.
No, because some patient may have postprandial high blood sugar in general. Okay. For this reason, to be sure about the diabetes, we have to advise oral glucose tolerance test. Not
Yes.
only fasting blood sugar. For this reason, fasting blood sugar will be the first door to open. That means in significant number of the diabetic patient, it will be positive, but not most of the diabetic patient. For this reason, the screening test usually done by highly sensitive test. If you come to the last one, fecal occult blood for the colon cancer. Already you know that if the fecal occult blood test is positive, to exclude, confidently to exclude colon cancer, what will be the next test? Colonoscopy with the biopsy.
Yes.
This is the understanding of the screening test. But to be sure about, that means to confirm the disease, we have to select a specific test. So these are the example of a specific test, and somehow we have to say these are the gold standard test. Gold standard test means this is the till now in the world, by doing this test, we will be sure about the presence of the disease. Though there is some limitation. For example, biopsy is useful for detection of the cancer, but you know that sometime for many reasons, biopsy may be negative. Okay.
Yes.
But why we are telling it is gold standard? Because till now, there is no better test than biopsy to cancer, to diagnose the cancer. Till now. For this reason, culture of the infected sample of or the infected tissue in the body is the gold standard test. Okay. In the biostatistics, randomized controlled trial is called the gold standard test for the drug testing. Okay, doctor.
Yes, sir.
Yes, sir.
Again, very interesting. I will tell you the another example. Actually, I don't know how many time we will spend today. Measurement of the blood pressure by the sphygmomanometer. Can we measure blood pressure directly? What do you think? That means this
Sir,
blood pressure means actually pressure in the vessel wall.
yes.
Are we measuring the pressure of the vessel wall?
Sir, it's arterial pressure.
It is okay. But are we measuring the pressure of the vessel wall directly? What do you think? You
Uh,
just imagine. No,
yes, sir.
no. We actually, the pressure in the vessel is transmitted from the body tissue through the skin to the blood cuff, blood pressure machine
Mhm.
cuff. From the cuff, there is a pressure impact. This impact is recorded by the barometer.
Yes.
If we want to say, oh, I want to measure the blood pressure directly, you have to place the, what I say, light the lead, like the ECG lead or something, or any barometer lead. You have to place it directly on the vessel wall. But we are not doing it. Understand? So
Yes, sir.
in that sense, the sphygmomanometer measurement of the blood pressure is actually one kind of indirect measurement of the blood pressure. Okay.
Yes. Okay.
So in that sense, you will understand what will be the gold standard test. But with the clinicians, actually, we are utilizing our non-gold standard test in day-to-day practice, because gold standard test usually will be costly, not easily available also. For this reason, we must know about our non-gold standard test, how the tests are quality test, how much they are giving the meaning for the diagnosis or detection of the disease. For this reason, we must know about the specificity, sensitivity, and other terms we will discuss. But before that, you can see the Wilson-Junger criteria for the screening. I will not tell detail. These are the list, because there may be a question, what is the quality of the screening test? And that means you will find that very, very good and useful informations are there. Everything will be best and best. But thing is that according to the characteristics, you will find no test till now available will be ideal screening test. Okay. That means everything
Okay.
will be good, will not be like that. This is the message. Now, our main target today is the performance or evaluation of the screening test. That means that our test will having sensitivity, specificity, and so and so. So we will come to a calculation now. I am requesting all of you, if possible, try your best to sit with your pen and the paper.
Okay.
And please draw this table and write in this way, giving you a few seconds, please. Otherwise, actually, will not understand my next talk. Just quickly write down in the paper. This is the disease positive column. Disease positive means gold standard test positive. That means we can say that finally I'm sure this is that disease. And test positive means actually we are testing the performance or quality of a test, this test, not the gold standard test. Okay.
Okay.
So this is that one, and there will be a total. I will give you example later on. What about the true positive, TPFP? Suppose you are doing a test to detect a disease. Some disease it will detect. Some disease means the actually patient have the disease, it will detect. But some positive test, actually the test will be positive, but disease will not be there. Try to understand this. I'm repeating. Any disease, that means you are diagnosing a patient with the multiple joint problem. Multiple joint means you are suspecting rheumatoid arthritis, but it may not be rheumatoid arthritis also. For example, in few patients in the rheumatoid arthritis, this test will be positive, no doubt. But rheumatoid arthritis, for example, rheumatoid factor will be positive for those people who don't have the disease. And this number will be called as false positive test result. So similarly, in the disease, it will tell negative. If you come to the right one, TN, we are testing, because you know that any test for a blood sugar also, we are testing many patients, all are not detected as positive. It is true. But actually, the patient does not have the disease. It is truly detected.
Negative.
Truly negative. We have to say it is a true negative. But the test will be negative, but actually disease was there. For example, rheumatoid arthritis, rheumatoid factor is negative, unfortunately, but patient have the disease. It may happen also. Clear, doctor?
Yes.
It will be told as
False negative.
Another example, very common in South Asian, tuberculosis. Tuberculosis. Manto test, you have heard it, right? Manto
Yes.
test.
Montage.
You can remember many cases in your training life, your teacher is giving the treatment of tuberculosis, but Manto test is negative. What does it mean?
Due to the action of the medicines.
No, 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 no. I am not asking about the
False.
reason.
Hmm.
The definition will be false,
Yes, false
false
negative.
False negative.
negative, false negative. Conversely, in South Asian people, patient does not have any symptom of tuberculosis, but Manto test will be positive. What does it mean?
False positive.
False positive. The same thing we have to understand. Now come to an example. Not example, sorry, the calculation. You may not write it. If possible, you just write this formula. Sensitivity means this, up to this only. Or you can make a snapshot also in the mobile phone or the device. Write down up to this 4 sentence, not down. I will let you in the subsequent slide to guide you. Don't be puzzled with the more informations. Only these 4. TP divided by TP plus FN like this. Specificity means Tn divided by Fp. Positive predictive value is TP plus divided by TP plus Fp like this. If anyone tell me if you finish your writing up to this only.
Yes, sir.
Second thing, the look at the upper part. The test positive, test negative. If I say the sensitivity of the test, the formula is true positive divided by
True positive plus false negative.
false negative.
False negative.
So what you are looking, where actually sensitivity indicates the positivity of the test. So numerator and denominator. What the TP is the numerator. Denominator is 2. So if you divide in this way, just I'm telling the technique how to remember. TP divided by up down. Do you
Okay.
understand what I mean?
Yes. Yes.
TP
Denominator is TP and FN.
and up down means up plus down. Okay.
And down plus up.
Up plus down.
Mm.
Similarly,
Specificity.
specificity by the definition actually utilized for the negativity by definition. So it will be Tn.
Down to up.
So no, actually up down or down to up, same thing. That means up down. In the denominator, Tn plus Fp. Okay. That means to remember, I'm telling the numerator always the TP. That means the true indicator of the positivity for the sensitivity. True indicator of the negativity is the specificity. So this is in the numerator. But in the down, up, down and up, down. To remember sensitivity and the specificity formula. Clear now?
Yes, sir. Clear.
Very interestingly, if you can remember the positive predictive value, again, the numerator will be TP, but denominator will be side by side. TP plus FP.
Okay.
Clear? So,
Yes.
so you can see there are 3P positive predictive, sorry, 2P, double P, positive predictive value. So these are all are positive in the down. You see, PP. And these are side by side. Okay. If any Bangladeshi colleague is here, I can say for him in his language, if anyone, how to remember.
Yes, sir.
Dr. Zakaria. So
Yes, sir.
P is the pasha pashi. Clear?
Yes, sir.
Positive predictive means pasha pashi. Okay.
Yeah.
Sorry for other. I am just adding something for him.
Nice, sir. Nice.
Pasha pashi, understand. Side by side. Side by side. So these 4 formula you can remember in this way. Okay.
Okay.
But don't forget these. True definition will be always in the numerator. Okay.
Yes.
Tn, you see TP, Tn, TP, Tn. Keeping in the mind. Now, these are the description, doctor. Actually, I will not tell too much. Make a snapshot. If possible, we'll provide the PDF in you, but even then, make a snapshot. The different colors are utilized to make you understand the inner meaning of this. You will read by yourself. Okay. Exercise means calculation you have to go through now. Dr. Nawaz, please, just can you go through this 3-4 lines?
Yes, sir. A screening test is applied to patients with and without disease X. Of 100 who have the disease, 60 test positive. Of 200 without the disease, only 20 test positive. The following table may be constructed.
Okay, you need to construct the table. How? You are
So
seeing
test score.
that a screening test applied. That means we are testing by any test. Patient with and without. The name of the disease is X.
X.
Okay. From there, 100 who have the disease. Remember, actually, 100 patient there, they have the disease. They have the disease means they are truly positive. Disease
Yes.
positive, right? Really, I'm not telling truly. They are the disease positive. But by the test is detecting the disease only positive for the 60 patient. Okay.
So 62
Sir,
positive.
not understand, sir.
Among the 100 patient, by the
Yes.
gold standard test, doctor, gold standard, it is 100 patient. That is truly diagnosis is 100 patient true, no doubt. By any test, even the by
Okay.
post-mortem or surgery, biopsy, whatever you say. But we are utilizing, for example, PSA like tumor marker or other. It is detecting the disease only 60. So how many
62 positive.
true positive?
62 positive.
So you can write down 62 positive in your paper here.
Yes. Then
Okay. Fine. Now, how many actually negative? Though disease is positive?
40.
40. So these negative actually not truly negative. These are falsely negative.
first not.
Yes.
So this is the 40.
Hmm.
TP, FN. And the total will be 100 here. You can write 100 here down, total.
Yes.
Okay. Now come to another information. 200 patient or the people, they don't have the disease. But your test detecting 20 tests positive of the disease. Is it truly positive or falsely positive?
False positive
False
20.
positive.
So false positive. False positive
Oh.
means above there will be 20
Yes.
And 180 is down.
and remaining 180 they are
Down.
truly detecting negative. So it will be true negative.
Yes.
So you can write here 180. So how many total again? Below 200. 200. Below 200. Actually, 200 patient disease negative, 100 patient disease positive.
Positive.
We are dividing in this way, true positive and true negative. Okay. Now, do this calculation by yourself. What will be the sensitivity? Your job. Take 1 to 2 minutes time. There may be a question in the exam. What will be the sensitivity? So for each question, you can take 1 minute time. Try your best. What will be the sensitivity? First tell me only sensitivity. So
0.6.
true positive 0.6.
6.
So 0.6 actually we have to express in percentage. 0.6 means 60%. 60%.
Also 60%.
Because sensitivity by definition will be expressed as percentage.
Okay.
So 0.6 means 60%.
60%.
60%. And the specificity, other colleague, other than Dr. Rita, other colleague can tell.
0.18, sir.
0.18. So it will be more than 100%, doctor. How it will be?
Yes. Like this.
0.18. The calculation may not be true. You put the TN. True negative is 180. Is it? So the numerator will be 180, is it?
180.
And the below will be
10,
200.
10%.
No, 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 no.
199%.
Maybe,
Mhm.
maybe. 180 divided by 200,
200.
right? 180 divided by
9. So
200.
Mm,
So,
9.
so your calculation will be 90% specificity.
okay.
Clear, doctor?
Sir,
Yes.
this is not understanding.
Specificity, you
True
have to,
negative?
it is the true negative. 180 is true negative, truly negative.
Ah,
This
okay,
is
okay,
negative.
okay. I
So
make it
divided by up and
negative.
down, divided by up and down.
Okay. I
Maybe
make
you are
mistake.
confused there. You have given maybe 20 up.
False
or something.
positive. I have done false positive, then true negative.
We have
Yeah,
to consider, we have to consider the specificity for the negativity of the test. Of the negativity of the test. Sensitivity actually word related with the negativity of the test. Okay. Now,
Yes.
again with the
Yes.
same patient, calculate the positive predictive value and the negative predictive value. I'm going back. Everybody try to share in the discussion. Otherwise, if you cannot write, actually not easy to understand this calculation. Identify the positive predictive value, PPP, so-called pashapashi. Now you can do. Again, positive predictive value. Positive means you have to write the true positive in the up and the remaining thing in the down. Clear?
25%. 75%. 0.75.
0.75 is the positive predictive
75.
value. 0.75. Okay. And negative predictive value, you have to write that true negative divided by summation of the side. Side means here. Let's see now.
80%.
So positive predictive value is 75%.
0.81.
And negative predictive value is 0.81.
81%.
81%.
81%.
All of you having the correct answer?
Yes, sir.
Those who have
Yes,
done,
sir.
but who are listener, I don't know. I am not asking
Sir,
you also.
what about the division? Should be calculator with us.
No, doctor. This calculation does not need calculator. Your simple arithmetic knowledge is enough.
Yes.
7 plus 5 will be 12. There is no doubt. Like this. If you say that I want a calculator now, what does it mean? This type of simple calculation is needed in the exam. So they don't want allow calculator because you may take something else also with the calculator inside the hall. So they will not allow you. Clear up to this, doctor?
Yes, sir.
Thank you very much. Thank you very much. Now, the mnemonic type word, rather to say, actually in our clinical practice, whatever we discuss the definition of a specificity, sensitivity, and other, we utilize the sensitive test for ruling out the disease. And we utilize more specific test for ruling in means including the disease. So rule out the disease, we utilize sensitive test mean initial test will be this one, screening test. So in summary, the more sensitive test will be utilized as initial test. In our
Yes.
layman language, but in the medical scientific word will be the
Sensitive.
it will be utilized as screening test.
Okay.
Screening test. Let's go now. If you understood, we can switch to the next. Okay.
Yes, sir. Carry on.
Again, exam topic, likelihood ratio. You can understand by by your own native language. What does that mean? Not easy to express, even in the English also. Likelihood. That means tendency. As much as possible, I am trying to explain tendency. So actually, it is not a complete word or sentence. The complete sentence will be likelihood ratio of a test being positive. Another sentence is likelihood ratio of the test being negative. This will be the complete sentence. I will show you now one example. In the text or even our clinical examination, we can tell conjunctival pallor is an indicator of anemia. Very, very meticulously go through the sentences. If I tell you, if conjunctiva is white, we are telling anemia, right, doctor?
Yes.
But what we are doing? We are doing the CBC result, in lab result.
No,
Can
we
you,
are just looking for clinical evidence.
no, it is clinically we are telling, we are looking at the conjunctiva and we are telling patient have anemia. Clinically we are telling. But to confirm it, we are advising for complete blood
Yes.
count to see what is the hemoglobin level. The actual hemoglobin level is indicator of the anemia, isn't it?
Yes.
But for example, for 10 patient, conjunctiva pallor, we are telling anemia, but we are not getting 10 patient hemoglobin level is low. This is reality. This is fact. Can you remember? If you can remember in your life experience, you are thinking patient having anemia, but your hemoglobin level is 12. Patient's hemoglobin level is 12. Very often it is found, especially if patient have mild anemia. Okay.
Yes.
So we are confused at that time. Whenever this is mild, we are telling confidently anemic or not. But we are telling this is mild anemic, moderate anemic, severe anemic. But especially for the mild anemia, this conjunctival pallor may not actually represent the patient having actual anemia. Sometimes it may happen, but sometimes you are right. Your observation is right. For this reason, presence of the pallor, you see, we are utilizing the word likelihood ratio. That means presence of the pallor indicating the anemia 4.49 suggests that patient with conjunctival pallor are approximately 4.5 times more likely to have anemia. More likely to have anemia means hemoglobin less than 90 gram per liter compared to those without the sign. That means other patient conjunctiva having the redness. That means actually we are telling a comparative meaning. Understand? Comparative meaning.
Yes.
Borderline pallor 1.80. When the likelihood ratio will be the borderline, sorry, the 1.80, we will tell it the borderline pallor. It indicates modest increase in the likelihood of anemia. Increase in the likelihood, remember, what I use the word initially likelihood. That means a tendency to be. But absence of the pallor. There is no pallor. So we are telling no anemia.
Yes.
So no pallor, the likelihood of the no pallor, likelihood ratio of the no pallor will be 0.61, means that there is the absence of the conjunctival pallor slightly reduce the probability of the anemia. Don't be busy with this description, doctor. I am just telling for your minimum understanding, not for detailed understanding. If you don't understand, forget it. Okay? Sorry to say. Don't be busy too much serious about this, because our target is to tell you the calculation how to do it. Likelihood ratio. Okay? So you will go through by yourself the text and you will understand. I tell you that it to be learned by reading by yourself. Okay. Anyway. Now come to calculation. Again, be with me with your pen and paper. Just write down this formula. Though it is not a complete formula, I'm just initiating my talk and trying to help you to remember this. LR, likelihood ratio. If you think in this way, sensitivity divided by specificity. Actually, we need to know is LR positive, LR negative. LR positive, LR negative. Positive means likelihood ratio of the test being positive. LR negative means likelihood ratio of the test being negative. So if the formula exactly like this, you can write this now. LR positive means sensitivity divided by 1 minus specificity. Dr. Nawaz, finished writing?
Yes, sir.
Okay. Again, if I show you the next one, LR negative, 1 minus sensitivity divided by specificity. For this reason, I started to write the word LR without plus and minus sign, sensitivity divided by specificity. This is the fixed. Okay, there is no change. But where is the change? Change here, LR positive, you are disturbing the sensitivity here. Sorry, you are not disturbing the sensitivity here, you are disturbing the specificity by writing 1 minus.
Yes.
Just try to make the thing understand, try to understand in a story what I'm telling. You are trying to disturb the specificity because plus is actually utilized for the word sensitivity always. And the negative minus is utilized for the word specificity. For this reason, the plus is not disturbing sensitivity, minus is not disturbing specificity. Okay? So disturbing
Okay.
means 1 minus 1 minus. Try to remember in this way. You will remember later also in this way. So this is the sensitivity divided by 1 minus specificity. This one, the LR minus is 1 minus sensitivity divided by specificity. So sensitivity by specificity is the fixed. The changes are there only 1 minus 1 minus. Okay. That I was uttering this word. Likelihood ratio of a test being positive. It is the LR positive. Similarly, likelihood ratio of a test being negative is LR negative. Now, that again your previous calculation. Can you calculate LR? Likelihood ratio of the same calculation. Already you identified sensitivity and specificity, right? Doctor? In the
Yes,
previous
sir.
calculation, you know about the sensitivity and specificity
Yes, sir.
that you express in the percentage, is not it?
Yes, sir.
Yes, sir.
But here you will utilize as the point.
Point.
Yes, because it is 1. Otherwise, you have to write 100. So 1 minus something means you have to write as point. That is a fraction. I'm not showing this one. Sorry, I can show the up to this. You have to use this point. Okay, doctor, sensitivity. Previously, it was 60% and specificity 90%. So now very easy to say what is the LR plus, what is LR minus. Quickly. Where is Dr. Zakaria? Are you doing the calculation?
जी sir. LR positive 6.
That
LR
means
negative
you have to say that the likelihood ratio of the test being positive is 6.
6.
You better. My suggestion to read the word in this way for better understanding. Likelihood ratio of the test being positive is 6 because it's the ratio for that is not percent. And likelihood ratio of the test being negative is
0.4.
maybe I am not sure. You calculate it. So 6 and 0.4. Very right. Fantastic.
Yes.
Yes, 0.4.
Fantastic. This is the way of calculating likelihood ratio. Maybe in the last exam of AKT, there was a question about the sorry, no, it was maybe odd ratio, something, not like that. But I am thinking until few years, the AKT exam will include Only very simple thing. The up to this likelihood ratio, and remaining thing we will discuss a little later. Okay. Hopefully you understood what we mean. Now come to another exercise. For example, again giving a clinical example of PSA. This is a screening test. And try to understand the scientists, they have set a value of the range that if the PSA is more than 20, it indicates a spread, metastatic spread. If it is more than 10, it indicates presence of disease. It is just assumption. Okay, this is their study or trials or whatever we say, they have decided. But it may not be 100% true, already you understood. Because there is a word of sensitivity, specificity, positive predictive value, negative predictive value. If you considered all the qualities of a test, we can say that actually this test, this message is not 100% right, but mostly they are right. For this reason, the scientist set a value more than 10 will indicate the presence of cancer. Okay. But it depends upon the age. You see, the reference range in this age of the PSA up to this will be the normal. Okay. If you say 4 to 14, why it is a long gap is there? Because if you say from there 4, the 4 within this range up to 6.5. But here 4.5, more than 4.5 will be positive for them in this age group. Okay. But 6.5 will be normal up to this for this age, but it will be abnormal for 6 to 69, 60 to 69. So there is an age variations. So many factors we have to utilize to say the test is positive or not. For example, even if I go back by the hemoglobin level, to say a patient is anemic, we have to consider the age of the patient. We have to consider the gender of the patient. You know that the naturally a newborn baby or the children have hemoglobin level naturally high. Okay, fine. Come to this one now. In a study, who will read? Dr. Rita, please, can you read now?
Yes, sir.
Please.
In a study of new marker for the diagnosis of prostate cancer, 100 consecutive patients referred to the pathology department were tested for the new marker and the conventional PSA test. It was reported that the new marker above the reference range had a sensitivity of 85% and specificity of 90%, positive predict value of 80% and the negative predict value of 95%. What is the likelihood ratio of positive test?
Positive
Yeah.
test means actually they have set the new marker above the reference range. I explained the previous slide, this reference range to make you understand this sentence. New marker above the reference range. Okay, there is an already set out range, but now they are testing above the reference range. If set for the new marker, how it will be, what will be the likelihood ratio of the test being positive. Now come to the calculation. You already got the sensitivity and specificity. Okay, can you calculate the LR plus now? This is the LR plus. Within 1 minute, within 1 minute time, what will be the LR plus?
8.5.
This will be the answer.
I
This
think
will be
so.
the answer. Okay.
Mm.
New marker, conventional. You are actually comparing the new marker with the conventional one. Okay. So calculation will be here like this. LR plus mean sensitivity divided by 1 minus specificity. So your calculation is 8.5. This is the calculation, doctor. I hope and I believe you may have many questions in your mind, but all questions cannot be answered. But even then, if you have some question, you can ask now.
Sir, actually, I'm just a little bit confused that they have given here the predict value as well. Negative predict value 95%, positive predict value. So it's just for the confusing, no? Means
No.
because the question is likelihood ratio of positive test. So
This is very confusing issue, not for you, for everybody throughout the world. The comparison, this is the proportion. We will provide the PDF also. You will go through definition and other. You will have it. The sensitivity and specificity actually comparing the disease. Okay, comparing the disease. But positive predictive value or negative predictive value comparing the test result, not the disease positivity. There is a difference. For this reason, otherwise you will be confused about positive. The word is different. For this reason, I am advising go through the text with you already, or we will be providing to you the inner meaning of this. Okay, it is throughout the world problem. So we like to give a break up to this about the screening test for you now. Now we will come to the other topic, maybe prevalence and the incidence. Maybe there was a question in the last exam. In general English, you understand the meaning of prevalence and meaning of the incidence. Who can give a little light of the word down? Anyone? What you understand by the word prevalence and incidence? In general English also, what you are thinking? No idea, doctor, to say? You are afraid to say also that the meaning of prevalence and incidence. What is the meaning of incidence?
The incidence, yes, number of new cases.
I'm not telling cases also. You can say that there is an incidence, few incidents of flood in Jeddah now. For example, in Saudi Arabia. Usually, actually, we cannot think that in Jeddah city there was a flood. What happened newly, and it is a matter of the news in the newspaper.
Yes, incident.
Right? Can you remember those who are living in Saudi Arabia? You know also.
Yes, in 2000.
There is a flood in the Mecca, the center of pilgrimage of the Muslims of the world. So we never think, actually before that, in the last 50 years, 30 years, there will be rain and the flood in the Mecca. But it happened. Okay? So something happened new. Something happened new. It is called incidence. But there is an hot environment in Mecca. It is always. Right? Almost. Most of the time of the year, the environment is hot. So this is prevalence.
Okay.
To utilize such meaning in the disease, we will learn now how to utilize it, the word. So prevalence refers to the proportion of a population. Proportion, doctor, remember, proportion means actually we have to divide something that has a particular condition or disease or character at a specific point of time or over a given period. How it will be said? Suppose patient of in the Saudi Arabia, or let's say in the South Asian countries, dengue patient. You know the dengue patient nowadays is very common in the South Asian countries. So if I ask you, Dr. Zakaria, in your country, how many dengue patients right now, today, in this time around here, 11:30? You don't know maybe. Exact amount you don't know, but you believe that Maybe few patients in Bangladesh now, there are some dengue patient.
Yes.
But
There
how
is a
many percentage of whole population of maybe 15 or 20 crore of people? This proportion will be told as prevalence.
Yes.
Okay. But if it is said over an year, or if it is said over a month, that means in this month of March, from day 1 up to today, not whole month, right? Today is the 16th March. In the 16 days, how many dengue patients are there? But by proportion over total population, it will be given a period prevalence. So prevalence will be of two types. One is called point prevalence, that means a point of time. Another is period of time, that means a defined area of the time. Clear, Dr. Zakaria or other?
Yes, sir.
There
Clear.
are two types. Okay. So
Point
actually,
prevalence and period prevalence.
yes. And it measured to understand how widespread a condition is within a population, But incidence, suppose usually in 1 year, there is an 30% of people having the dengue. But in this year, if there is detection of the dengue, some new patients, it will be told as these new patient as incidence of dengue, not the prevalence of dengue. This is very easy to understand. The new detection over the previous limit, this will be the incidence. Okay. Already we discussed it, and this is the definition or formula to calculate. Again, requesting you to write down in your paper number of existing case at a specific time. It may be the point of the time or the range of the time divided by total population. It will be expressed again as percentage. Point prevalence. Specific time is the point prevalence. If it's the duration of the range of time, month, day to day, 1 month, 2 month, it will be the period prevalence. Period prevalence over a year, for example. So the incidence refers to the number of new cases of a disease or condition occur in a specific population during a defined period of time. It will not be actually single, because to detect the disease, only 1 minute is not enough. So for the 1 minute, we can say the prevalence, but for 1 minute, we cannot say incidence. Incidence need time. For example, for this reason, incidence is described over a period of time, not a specific point of time. It is called the new cases. New cases. Dr. Nawaz, what do you
Yes,
think?
sir.
Is clear a little?
Yes, little clear, yes.
Though may not be too much. So repeating, prevalence reflect existing cases, incidence reflect new cases.
New cases.
If you can remember in this way also enough. Now, come to this description. Who will read? Any new colleague? Dr. Zakaria, feel free to read it for us, as you are free maybe today. Can you read it, please?
In a study of elderly patient with atrial fibrillation, patient receiving warfarin,
That means the number of the patient
number
is
of
6,000.
6,000 were found to have a rate of stroke of 6.6%, whereas subject treated with aspirin, number of patient 8,000, had a stroke rate 9.9% over the 3-year study period. Prevalence
P value,
P-
sorry, you may not understand, as I didn't discuss, I will not discuss also. P value is another thing. 0.001. This is actually it indicates the correctness of the result. Correctness. Forget this. Actually, there will be no calculation. They will ask about the definition. Do you understand or not? And the next sentence.
The risk of stroke is an untreated population with atrial fibrillation over this time was 12%. To what do these numbers relate?
That means they're telling three sentences. One is warfarin receiving patient, their development of the stroke 6.6%. The aspirin receiving patient, their development of a stroke is 9.9%. But those who are not treated with the atrial fibrillation, their stroke development is 12%. So this percent, what do they mean? A, B, C, D, E.
Prevalence.
Sorry, doctor?
Prevalence, D. Because
Prevalence.
or
Increase in percentage.
adjust
Incidence, increase in percentage.
Incidence. Why incidence, doctor?
Sir, increase in the percentage.
okay, yes.
Yes, this is a new happening.
Yes.
It is new happening. They didn't have a stroke before. They are happening over the year. Even
And
they are getting the
increasing.
treatment. Even they are getting the treatment.
Hmm.
Is not clear
Yes.
now?
Yes.
So new happening means incidence. New happening means incidence. But remember, in these 3 years, in any area, any country, already some patient have the stroke, isn't it?
Yes.
Already they are having the stroke, but new development 6.6%. So this is incidence, not prevalence. But if you ask about the total, the stroke patient usually prevailing in the country, it will be the prevalence.
Yes.
So incidence of a stroke is new case here. So this is incidence. So now there's some other calculation, relative risk reduction and other. I will not tell you because I will discuss it a little later. How to calculate this thing. You may not understand now. So now, what does it mean? Another question. Who will read, doctor? I find the mic open. Dr. Gayani Ratnaayake. Can you hear my voice? Possibly new colleague today, another one, another Sri Lankan colleague, another name. Sorry. Dr. Ramiz here. Dr. Ramiz. Ramiz is sometime remain busy. Who will read it?
Me, sir.
Dr. Nawaz. Okay, please.
In a study of 26,000 females, 1,300 subjects were found to have either overt or subclinical hypothyroidism. Within this group, the risk of demonstrating either overt or subclinical hypothyroidism was therefore 5%. What is the best descriptive term of this 5% risk?
Now try to understand. Is it any new happening or already they are having
Already there are now. So 13.
So this 5% is not, if not new happening, what will be the answer?
Prevalence.
Prevalence.
Now clear difference of incidence and prevalence?
Yes, sir. Yes.
Right. So again, new case is incidence. Remember in this way, new case is incidence, but not new is prevalence. You can sleep now. Biostatistics
Really?
After biostatistics, sleeping mood.
is as such, and we have to learn in this way. Maybe you can learn by your own way, in a better way also. Is a little different class today, right? Not like other clinical topics. Good.
This is difficult for everyone.
But hopefully from now onwards, you will have,
Yes.
you will find
Yes, a
topic will be
little bit
relatively easier. Relatively easier.
Yes, sir.
So now come to other major headline. Measures of association. Association means club, party, political party. We mean it, right? But in our medical science, association means exposure, and outcome. Exposure may be disease factor exposure, or exposure may be the treatment, medication, medicine, and the outcome. So this is the association, and we will try to understand if any bad association, we will tell there is a risk. If the bad association, so how to calculate the risk now, right? We are thinking what doctors are thinking. Most of the time we are thinking good thing or bad thing, doctor, for the patient. Doctor, why not responding? About
Yes,
our
good
patient.
thing. Good thing.
We are expecting good thing, but
Okay,
we are
how?
thinking always bad thing. We are thinking always bad thing, but we are expecting good thing as outcome.
Yes,
Understand?
Yes, sir.
Our expectation is good, but our thinking is bad because we are thinking this patient might have cancer, this patient might have diabetes, this patient might have hypertension. All are bad thing. So these all are the risk. Okay.
yes,
And now come to another chart. Can you copy this in your paper, please? Just for understanding. Paracetamol given for the pain relief in the dysmenorrhea. Paracetamol given for the as a pain reliever for dysmenorrhea. So the always actually we are comparing is the word for the biostatistics. Whenever we tell the medicine is good, okay, suppose as a painkiller, you can say that diclofenac will be better than paracetamol. For this reason, we're telling diclofenac is a good painkiller. Okay. That means we are comparing with other. Again, if I tell, if Dr. Nawaz don't mind, I'm not about you, I didn't see you. Dr. Nawaz is taller than someone. Why we're telling Dr. Nawaz is taller? Because someone is shorter. Isn't that it, Dr. Nawaz?
Yes, sir.
But you may have your relative or friends and other maybe taller than you.
Yes, possible.
At that time, you will be shorter and other will be taller.
Very true.
So nothing is absolute in the world. Those who are believer, they are telling Almighty is the absolute only in the world or the universe.
Very
Another
true.
spirituality is to say you only. So everything is a matter of comparison. Now, paracetamol is a painkiller. We are telling because we are giving the paracetamol for painful patient of dysmenorrhea, they are relieving the pain. But it is also true if we don't give any medicine also, the dysmenorrhea patient will get rid of the pain. Is not true, doctor? All people are not getting the medicine. Even then they are having the relief of dysmenorrhea. It is true.
Yes.
For this reason, if paracetamol is giving the benefit or not, we have to compare with the placebo. It is just a study, trial, whatever you say. In the study placebo, what is the meaning of placebo? This is a medicine-like material without active component of the medicine. Isn't it?
Yes, sir.
We are giving to the patient. Patient doesn't know what they are taking. It is a, right, it is a method of a study that patient is given randomly. Some patient will be given paracetamol, some patient will be given placebo. You will know, but patient does not know. Anyway, so we selected 80 patient to give. 80 patient have dysmenorrhea. But the bad thing happened. For how patient bad thing means
20.
patient or even taking the paracetamol, they experienced pain. This is the event. So remember the word, one is called the event, another word is control. In the event, 20 happen. But in the placebo group, how many event happen?
80.
80.
80. So what does it mean? Without medicine also, 20 patient get rid of pain.
Yes, sir.
Pain is relief. This is the miracle in the nature. right? For this
Yes.
reason, in our real practice also, sometime our teachers or expertise are telling that, oh, you see how marvelous this medicine, it is giving or curing the patient. Actually, it is not a scientific comment. This cure of the patient may happen even without medicine. Understand?
Okay.
Again, I am
But
telling
very few
that,
percentage.
no, maybe few percentage, but without medicine, it is being cured. For example, infection, infective disease, without antibiotic, it is cured. Many often, suppose a small focus of infection in the skin, even without antibiotic, it is healed. Is not it? It is
Yes,
healed
yes.
by the immunity, for example, in the body. So it doesn't mean that medicine is curing everything. So this is the philosophy of understanding. Now, how to calculate these words? These are actually definitions. Experimental event rate, control event rate. So what is our event? Event is
20.
pain.
Yes.
Mane persisting pain, experience pain. What is the experiment? Experiment means experimental matter is the paracetamol drug. Okay?
Okay.
That means we are making a study on the paracetamol. So in the paracetamol group of the patient experiencing pain, the number is 20. So risk means bad thing, right, Dr. Nawaz? Always we are telling the risk factor, risk factor.
Yes, yes, yes.
So again, risk is a bad thing. So absolute risk of having the pain, absolute risk of having the event, is not it?
Yes.
The main word is experimental event rate. I'm not telling experimental pain rate because the definition is experimental event.
Mm.
The event may be something else, not pain or other thing also, vertigo or other symptom. So experimental event rate, in another word, it is called absolute risk. The abbreviated form is EER. The calculation is 20 divided by total number of the patient. Clear? So 20
Yes.
divided by 80 means 0.25 or
25%.
25%. Just try to remember this word and please keep note in your white paper. Second point, control event rate. That means the event happened in the control group. That is the placebo group. So this is the absolute risk of the event rate, control event rate, absolute. This is also another absolute risk. In the control group, again the calculation is same. Total is 100 and event happen in 80. What is that now? 80%. It is just simple calculation. Clear?
Yes.
Dr. Nawaz, do you need
Yes, sir. Yes.
do you
Yes.
need calculator again, Dr. Nawaz? What do you think? Possibly no. Possibly no. So that was the result in the first two line. Already we calculated, right? Experimental event rate and control event rate we already calculated. Now, what will be the absolute risk reduction? This is the formula. Better to write. If anyone become lazy or some, you cannot write, you can make the snapshot of the screen. But it's better to write for learning. Another next terminology will be absolute risk reduction. So there is a difference. Absolute risk is one thing, absolute risk reduction is another thing. The difference is absolute risk reduction. Difference between these two. And the another word, relative risk. It is not the reduction. Relative risk. Relative risk is EER divided by CER.
Okay.
So it is actually a matter of you to remember this formula. EER divided by CER. But this is not the divided by, this is the difference. This is by the minus. So this is the relative risk. So relative risk actually not by percentage. It is a figure only because this is divided. So you can now say that relative risk is 0.3125. That is less than 1. Relative risk is less than 1. So what is the relative risk? Relative risk of pain. Right? Relative risk of the
Yes, sir.
pain happening.
Dysmenorrhea.
This is the relative risk. Now, next term is relative risk reduction. This is absolute risk reduction divided by controlled event rate. CER, control event rate. It is 0.6875. Now, number needed to treat 1 over absolute risk reduction. So absolute risk reduction is the third line. So number needed to treat is 1.818. Don't be afraid. Till now in AKT exam minimum, this type of calculation I haven't seen. But it may be relevant for MRCP part 1 exam. MRCP part 1 exam. So our lecture will be relevant for the MRCP aspirant as well, no doubt. Yes, doctor, what do you like to know?
Yes, sir. This is here it is written relative risk and the relative risk reduction. So what is the difference between both of them now? Exactly means
Relative
not
risk and
relative
relative risk reduction. This you see,
reduction, yeah.
formula is different, doctor. It has its own meaning. If you go through the text, you will understand in the biostatistics books or
Okay.
literature. Okay. I am just trying to guide you how to calculate only, because calculation is not easy. Calculation to be discussed, calculation to be supervised. For that, our class attention is to calculate this one. For example, number needed to treat, you can understand very easily. Possibly I will show it a little later also. NNT, number needed to treat, though calculation is different. Yes, it is there. Number needed to treat, according to the formula, you understand that this is the inverse of ARR, absolute risk reduction. But the meaning is very simple. If I tell you the story, I think it will be easy for you. The number of patients that need to be treated to prevent one bad outcome. One bad outcome, for example, we are utilizing the medicine statin to prevent stroke, isn't it? Or warfarin to prevent a stroke. Whatever we say, for example, statin, we are using the statin to prevent stroke. But in reality, whenever I give 10 patients statin, will you see that all 10 patients will not have a stroke in future? What do you think? No. No. Few of them will develop a stroke.
Yes.
This is the reality. Actually, we cannot prevent 100%. Okay. Now, come back again. In the 10 patient, we have given statin. Only one person will not have a stroke in their life. So what does it mean? We have to treat 10 patients to prevent one stroke.
One bad outcome.
Isn't it?
Yes.
So to prevent one bad outcome, number needed to treat will be 10. Clear?
Yes.
Dr. Nawaz?
Yes, sir.
So to prevent one outcome, for example, we are giving aspirin in the ischemic stroke or prevention of the stroke, in the ischemic heart disease also to prevent myocardial infarction. But it doesn't mean that it will prevent 100%. This is very fact, very true. So in the calculation, if to prevent one case, one outcome, bad outcome, we need to treat 5 patients. It means number needed to treat is 5. This is another way of understanding NNT. But calculation method is 1 by ARR. Similarly, I will tell you another word, possibly not here. It is called number needed to harm. If it is not in the coming slide, let's learn. Can you write in your paper? NNH. It is not shown in the slide. Number needed to harm. It means side effect. It is to prevent bad outcome. That is the expecting good thing. But number needed to harm, we are expecting bad thing. Suppose aspirin causes peptic ulcer disease. But do we believe that if I give aspirin 10 patient, all the
No.
patient will have the peptic ulcer disease? No.
No.
Maybe one patient will have, I'm not telling the 10, he will be afraid, maybe 5, for example. We are giving 5 patient aspirin, only one will have peptic ulcer disease. There is the harm, side effect. Okay. So to happen a bad happening, only one bad happening, how many patient we are giving aspirin?
5.
5. So number needed to harm will be 5. Okay. Now a quiz to you. The number needed to harm is more, maybe 20, 30, for example. It is a good message as a doctor or for the patient, or bad message? Suppose if I tell number needed to harm is 5. Another example, number needed to harm is 10. Which is better?
5.
The 10 is better or 5 is better? 10 is better, because only one thing happening after giving aspirin to the 10 patient. Only one
Yeah.
happening. But in another example, we are giving 5 patients. From 5 patients, 1 patient will develop the bad thing. For this reason, number needed to harm is bigger, is better. Okay. Conversely, number needed to treat, what you are looking now in the screen, is 5 is better or 10 is better? Number needed to treat,
5.
5 is better, because we are treating only 5 patients and we are getting one good outcome. But in the 10, we need to treat 10 patients to prevent one bad outcome. 9 patients will have the suffering even we are treating. So number needed to treat bigger is bad. Number needed to harm bigger value is good. Now, how it helps in our economy of the country, in the health sector? To prevent one stroke, government paying the money to treat 10 patients by statin. Okay. In another, to prevent one stroke, government giving the money for the aspirin to the 50 patient, for example. Right. So what is the look to the messages? To pay money for the aspirin is better or a statin is better? We have to treat 50.
Aspirin.
No, aspirin in another way better. But I'm telling, suppose cost of the aspirin and the statin is same. The value price is same. In this way, we have to treat 50 aspirin patient to prevent one thing, but we have to treat only 10 patient by a statin to prevent one bad thing. So which is the better group? Statin is the better group. Statin better group. So if the cost is same, government will pay money for the statin, not for the aspirin. In this way, the number needed to treat these biostatistic value can help the government to pay money. Okay.
Okay, sir.
Let's see now. Now try to make a calculation. Hopefully, you will be with us until we finish the class today. We are going very slowly. So, Dr. Nawaz, please, can you read?
Yes, in a study of 20 anginal medication, the primary outcome of the presence of stable angina pain while walking on flat ground was reached by 65% of the patient taking drug A and 60% of the patient taking drug B. How many people must be treated with drug B rather than drug A for one person to not have stable angina pain when walking on flat ground?
Now you understand that actually they are asking about possibly number needed to treat, right?
Yes,
Maybe number needed to treat. From there, actually we, for our practice purpose, stepwise try to identify the value. What is the experiment? What is the control here? A or B? Drug A, drug B. Which one is experiment here?
Sir, drug A.
Must be treated with drug B, right? Must be treated with the drug B rather than drug A. So we are comparing the B over A, is not it? Clear now?
Yes, yes.
We are comparing the B drug. B means, for example, maybe a new drug. It is an old drug. So drug A will be the control here. When walking on the flat ground, that is prevention of the angina. We are thinking about outcome will be the prevention of angina. So our event is angina. Isn't that it?
Yes.
So let's calculate now the 65 and 61%, what they're telling about stable and outcome of the presence of stable angina, outcome of 65%. So control event rate for the drug A, how many percent? Already given, the value given, you don't need to calculate. This absolute risk of the experimental event rate is 65% for, if it is an experiment which one? B. Doctor? If experiment is the B is 60%, is not it?
Yes. Yes.
And control is 65%. Just remember up to this, we are going to the next page. So experiment is 60%. The event rate is 65%. Now calculate this way. Absolute risk reduction. This is the difference.
So
what will the
5%.
value? 5%. Then relative risk. EER divided by CER. What will
0.5.
0.5. We are telling 0.5. EER, what is the EER? Is the 60. 60 divided by
65.
CER, 65. 0.5. Relative risk is less than 1. Isn't it?
Yes.
Less
Yes.
than 1. It means actually relative risk is less. Then relative risk reduction. ARR divided by CER.
0.0. This how much?
Are you writing in the paper, doctor, now?
Yes, sir.
Good, good. Now number needed to treat. 1 over ARR. What will be? It will be a full, it will be the full figure. ARR. 7, 8, 5 or 10 like this. And this is actually target. They are not asking NNT, but they are telling in a descriptive manner how many people must be treated with drug B rather than drug A. So it is your job to identify which will be the control, which will be the experiment. Actually, question is not containing the word experiment or control. It is your understanding I am putting here. The 1% to not have a stable angina pain.
5%.
NNT will not be percent, doctor. NNT will be number. For this reason, A, B, C, D, they are not telling the percentage. So how many actually here you got?
5.
5.
Yeah,
Sorry,
20.
it will be 20. Recalculate. There might be some mistake done by you. 20. maybe you may get some guidance here, the down. So calculate the ARR. ARR means 0.65 minus 0.60.
Okay. I just 60 and then
0.65 minus
65.
0.60.
Yes,
So 5% means actually 20. 1/5. Sorry, not 5%. 1/5.
yes.
1/5. This is 20. Understand?
Yes,
Yes,
sir.
This is 20. So that is that value. So this is the way of calculating number needed to treat. Don't be busy. Don't be puzzled. Get relaxed. So another example. NNT 25 means we have to give treatment to the 25 patient to prevent one bad outcome. Again, the NNH, that slide is there. The number of patients need to be treated to occur one bad outcome. It is to occur one bad outcome. It is to prevent one bad outcome. Okay? Occur is the bad thing. Isn't it? Bad outcome. It's the prevention is a good message. So it's a similar word, and I am very actually thrilled to tell you, whenever you go through the medicine book, textbook, you may find this word NNH, NNT. It will be easier for your medicine book reading. Otherwise, you will be rather to say puzzled. What does it mean? Okay. Can we continue a few minutes more?
Yes, sir.
Very,
Continue.
very important thing remaining, a little only, not too much. Odd. What is the odd in our language? Bad thing.
Yes.
Odd occurrence, awkward occurrence, we are telling, right? Even, odd number, even number, we are telling, right? Odd scenario, we are telling, odd scene. That means something negative. But statistics, not always the odd is bad. Okay? Let's see. So there are two words. I'm going back. One is the odds, another is the odds ratio. Please write down in the paper. Don't only be listener or viewer. Write down in the paper. Those actually you really want to learn. If you don't feel interest, okay, you can be busy with other work, no problem. But those who are here connected, write down these two things. Odds, and otherwise odds ratio. You understand now the ratio means there is a numerator and denominator.
Denominator.
But in the odds also is a matter of ratio. Denominator and numerator. What does it mean? Only odds ratio means
Denominator. Odds.
I will give you the example, then you will understand. Maybe whether a particular exposure associated with increase or decreased likelihood of a specific outcome. It is just understanding of the word, whether particular exposure and outcome issues. But the formula for the odd ratio is, you just look at the down. Exposed and unexposed. Exposed means you are, again, you can remember the paracetamol. You are giving some group paracetamol and some group not. So if you are
Giving the paracetamol.
For example, it is not only
Means
medicine.
exactly.
It
No,
is not
no.
only medicine, maybe risk factor also. Exposed or not, exposed or not. So word is exposed or unexposed. Okay. So if unexposed, we are telling these are control. Okay. But outcome will be different, you understand. If I give the placebo also, some patient will have pain, some patient will not have pain.
Not.
So there are, again, outcome are two. Okay. Anyway, first of all, odds ratio is the ratio of the odds. You can look at the down.
Yes.
Ratio of the odds. Now we need to know what is the odds. Odds of the exposed, odds of the unexposed. Now, again, make this table, please. This table. Paracetamol for dysmenorrhea pain relief. The experimental group, we are telling group 1. And the placebo group, we are telling group 2. For understanding. In the paracetamol group, 2 outcome. Pain relief 40. Pain not relief, how many?
60.
Sorry.
Total patient is 60.
60. So pain relief 40. Pain
40,
not
20.
relief
20.
20.
Yes, 20.
We are reading the odd in different way. Again in the placebo, pain relief 30. Pain
60.
not relief
60.
60. So now you can understand that in the paracetamol group, there are 2 outcome. Is it? So incurring the outcome and another group non-incurring. The word will be utilized now. So now in the later the below, odds of this paracetamol, odds of the placebo separately we are thinking. That is odds of the group 1 who incur an expected outcome to the number of the people divided by who do not incur the expected outcome. Okay. So we are thinking the group and group 2. If it is so, now come to the calculation. Pain relief. Expected outcome was pain relief. So if I make a dividing, pain relief happened how many?
40.
Sorry, or pain relief or pain not relief?
40, sir.
40.
Pain relief 40. So pain relief 40 and not relief 20.
20.
So ratio of these two is odds of the experimental group. So odds is 2. Again come to the placebo. In the placebo, what will be the odds?
30.
Pain relief 30, not relief 60,
not relief 60.
only
0.5.
0.5. So these are separate odds. So what will be the odds ratio?
4.
Odds ratio will be experimental group above and the control group below. Group 1 and group 2. So odds ratio will be 4. This is the way of calculation of the odds ratio. Dr. Nawaz.
Yes, sir.
Do you need again calculator?
This is simple calculation.
So you understand. No calculator needed. Only brain calculator is enough here. It's a primary school calculation, isn't it? But to do it, we need to have understanding how to calculate. So this is the odds ratio. Possibly there was a question of the odd ratio in the last year exam, maybe in the within 1 year. So far I can remember. So actually the group 1, group 2, I mentioned here for your understanding. But in the question, in the exam, they will not mention in this way. You need to understand what will be the group A, group B here. What will be the group 1 and group 2 here for your better understanding. Okay. So at the 11th hour, one exercise for you. Dr. Rita, can you read it?
Yes, sir. Yes, sir.
Please.
In a primary prevention study of stroke, comparing a new antihypertensive with conventional antihypertensive therapy, the number of patients who had a stroke over the study period was 200 in group 1, with the new therapy and 5,200 versus 250 in group 2 with conventional therapy and 4,750.
That with the conventional therapy number, patient number 4750. But in the group 1, new therapy, the new therapy given over the study period was 200 in group 1. That means the total is 5,200. Here only 250.
250. Which of the following is the
approximate odds ratio? So there are two groups, right? Yes, group 1 and group 2. So we need to calculate the odds ratio. We need to calculate first odds of the group 1 and odds of the group 2. So now calculate the odds of the group 1. So make the calculation.
Group 1 is
Total was 5,200, but
600
the stroke developed 200.
and 200
So this is the
means
outcome. It's the outcome. Outcome means a stroke.
200
Outcome means a
so
stroke.
5,000. This will be
So in the
5,000.
5,200, so incur means happening. A stroke happening 200, non-happening how many?
5,000.
5,000, right? Not 5,200. I think you can do now. In the second group, total 470. So 250 is the outcome. That means happening incur.
4,005 and
So
250.
4,500 is non-incur. So let's try to calculate first these odds of group 1 and group 2. In the one group. Odds of the one group, odds of the, suppose the group 1. So what is the odds of the group 1?
0.25.
Other doctor, what you are thinking, calculating? That means 200 divided by 5,000. Isn't that it? 200 divided by
5,000. Yes.
5,000.
Yes, sir. Yes.
And in the second group, conventional
second
therapy.
group.
Conventional therapy. Actually, exposed, non-exposed, I follow the previous word. This is one is the new therapy group. Another one is the unexposed, means conventional therapy group, group 2.
0.45.
So 0.05.
6.
Or 5, 6, whatever. So these are odds. So odd ratio will be,
Ratio.
there is the exposed.
0.7.
That is the new therapy odds divided by conventional therapy odds. It will be the conventional therapy odds. 0.72.
C.
So this is the answer. So your text is very heavy, very much, but your calculation is very little.
Difficult to remember all these formulas.
You need to remember. Otherwise, how can you pass the exam? You remembering many things, doctor.
So can you little bit back the slide? No, this one downward.
Down means?
And downward calculation. Yeah, this one.
one.
This one. This one. Oops.
Okay, doctor.
Okay.
Just a minute, sir.
Yes, please. Anything to ask here from there, Dr. Nawaz?
Writing
No,
something.
it's okay.
You can make a snapshot of this total picture
Yes,
also,
yes,
if
yes.
possible. But better you have to go through or listen the discussion class more times.
And this will be also.
So we have these type of question as well.
Maybe, doctor, in future, because the odds possibly happen, odds related question in the last year. So far I remember. For this, I have added this. I have the previous lecture, you know, already, but in the previous lecture, I didn't include the odds ratio and other. For this, it is actually designed for the new batch, the coming exam, to cover this thing. Otherwise, we have already recorded class before, not up to this now. We have added something. We like to conclude now, doctor. So try to keep something in your brain, okay? And now I'm afraid that you may not ask me anything, any question now, right? So hopefully he will understand, and don't forget
But
to
it was
go
very
through
nice
the lecture
class.
again and again, okay?
Yes,
And
sir,
don't
with
keep
the
the
practice.
lecture, don't keep the lecture apart 1 month later. Rather, within tomorrow, day after tomorrow, review the lecture, discussion again.
Yes,
it will be easy. Otherwise, many things will be lost from your brain because you are not culturing this thing in our day-to-day life.
Sir, thank you so much.
And
Thank you, sir.
thank you to be with us for today.